Welcome back. I'm your host, Jeremiah Yang. Earlier today, we sat with experts from the Hoag Spine Institute, and we focused on back pain. Now, I'd like to take the opportunity to switch gears and talk about the topic of pain. You know, many of our viewers probably have lived with or dealt with back pain, neck pain, shoulder pain, knee pain. And it's these everyday aches that we seem to grow and live with just because we're getting older. But the question is there something that I can do or someone that I can see to help me treat these pains that we are forced to live with? Today, we have two experts from the Hoag Pain Management program, Dr. Kareem Fahmy, a board-certified pain medicine specialist, and Sarah Vargas, one of our certified physician's assistants, also a pain specialist. And they're both here today to help us kind of navigate the topic of pain. When is it appropriate for us to seek help? How do we understand when pain is more than just something that's going to go away? And they're here to talk about some of the advances and some of the treatments that are available at Hoag Pain Management. Thank you both for being here today. Dr. Fahmy, let's start with something very simple but so important. What is pain?
Yeah, you're exactly right. It's a simple question, and a lot of us think we know what pain is, and we tend to ignore the pain that we have. But that's the problem, because pain is our body's message to us, telling us that something is wrong. Pain is not normal. We shouldn't be living with pain. And pain, we tend to think of it as a physical ailment, but in reality, it affects our mind, our mental health, and our physical bodies. And because of that, we tend to have difficulties with our daily living, our quality of life, interactions with our friends and family, inability to do basic things. Patients come to me all the time having difficulty just showering or getting up and walking around. So the key thing to remember is that pain is a message from our body to us. And when we have that message and hear that message, it's important to act on it and not delay. Because when you delay is when we tend to encounter some of those complications with pain and difficulties living life with pain. But if we can get to the pain early on in its course, then we can usually do something about it to prevent it from getting worse. So my message to patients all the time is don't ignore the pain. When you feel it, say something and see someone.
That's a very important distinction. So, you know, folks should not just think that they have to live with it and just deal with it and accept the pain that they're living with. Sarah, as a physician's assistant and a member of the pain management team, can you just talk to some of the types of pain that you or Dr. Fahmy or the other pain specialists would treat?
Yeah, so by and large, I would say our most common pain that we see in the clinic is back pain and then neck pain as well. It's very common, though, that when patients have those types of pain, other things start to become a problem as well. Whether that's knees, shoulders, hips, we commonly treat chronic pain, neuropathic pain from nerves having different issues. We also treat a lot of cancer pain as well, which is one of my favorite types of pain to treat. We can make a big difference in people's lives. And then some headaches and facial pain as well. So definitely a big variety.
Sarah, thank you for explaining the different types of pain. Now, Dr. Fahmy, as a physician, can you speak to more of like the root cause of pain?
Yeah, absolutely. Because oftentimes patients come in and say, I have pain in my foot. Sometimes it's coming from the foot. Sometimes there's an issue with the ankle or the foot bones or arthritis in the foot. And in fact, other times that pain is coming from the back. When you have pinched nerves in the back, pinched nerves in the neck, it can cause pain elsewhere in the body. We have different ways to describe pain. Commonly, patients come in and say sciatica is an example of that, where it's pain that starts in the back but radiates down the entirety of the leg. So my job, when you come and see me, is to figure out where is the pain coming from. And there are plenty of times where we have been looking at the pain in the knee as a knee problem, but in reality, it's coming from somewhere else. To do that, I utilize a thorough physical exam. And on top of that, we have state-of-the-art MRI. We have procedures, diagnostic procedures, nerve conduction studies that we can utilize. So everything taken into consideration together can help me really pinpoint the cause of the pain, because without figuring out the cause, well, what are we treating? So that's a critical component to treating patients with pain.
And now that we're talking about treating these types of conditions and the various procedures and techniques that you just mentioned, I understand that Hoag's recently opened up a new procedure center specifically dedicated to pain. Can you speak to what can patients expect at the new procedure center?
Yeah. First of all, it's an incredible, beautiful, state-of-the-art facility. I'm lucky to be working in a facility with this kind of equipment and team of nurses and staff that help me do what I do best. The facility itself has 3 brand new procedure suites. In those suites, we have capabilities for X-ray guided procedures, ultrasound guided procedures. These are injections such as cortisone and epidural injections that we do under the guidance of those imaging capabilities. We also have the capabilities to do things under anesthesia or sedation for some patients. So the facility enables me to do certain procedures at a high level, the highest level, in the safest way possible, with a full team of nurses, radiology technicians, medical assistants, physician assistants, and the physicians, of course. So all of this is for the patient, to make sure that we're doing our best to treat these conditions that we have diagnosed and assessed in clinic.
That's great. Well, thank you for that, Dr. Fahmy. Sarah, can you speak a bit more about what patients can expect and what they're going to experience at this new procedure center?
Absolutely. So it's an outpatient procedure center. It's not in the hospital. So that's designed to make patients feel more calm and relaxed when they're coming in for their procedure. Everything about it is, of course, focused on patient safety as well as comfort and really streamlining the experience so it's very smooth and goes very well on the day of the procedure. We've paid very special attention to having the same team that patients will see in the clinic be involved in their procedure as well, from the physician down to every other staff member that's part of their experience. And it really helps patients see a familiar face when they arrive for their procedure. We definitely understand that sometimes patients can be a little bit nervous when they're going in, but everything about the experience is designed to help people feel comfortable and safe and have a successful procedure.
That's great. So I'm hearing things like state-of-the-art guided technology that helps guided precision injections and interventions. I'm hearing it's a very safe, serene environment, familiar faces, and being outpatient too. It also makes it more convenient for our patients. So that's great, and that's an amazing thing that Hoag's doing with this procedure center. Well, let me then kind of shift our attention to Hoag's approach to pain management. What makes Hoag unique in how Hoag delivers care through the pain management program?
What makes our approach unique is our multimodal way of caring for patients. So, we understand that pain is not a one-size-fits-all, issue, and we don't treat it with only one solution. So our approach always takes into account physical therapy, different types of injections that might be indicated, obviously pursuing the appropriate diagnostic workup that Dr. Fahmy had mentioned previously, as well as medications when indicated for patients.
Can we talk a little bit more about medications? Is that a supplement to the overall, whole body, whole person healing program? Is it what's more details to to medication management and how that's worked into the overall care plan when it comes to treating pain?
Yeah, and that's a great question. Medications are important, and there's a time and place for medications. As Sarah said, our approach is multimodal, which means we utilize different treatment avenues to address the pain with physical therapy, chiropractor, acupuncture, rehab, all in collaboration with your team of physicians and physician assistants. And so there is a time and place for medication, but that's not the only way to treat the pain, because the goal is not to simply mask the pain and hide the symptoms that we were talking about earlier that we wanted to figure out the root cause for. But when appropriate, it can be used in conjunction with the larger treatment plan. And it's important to have collaboration with patients to understand what their goals are so we can best treat those goals with or without medication.
That's great. And that's good to hear too, because I know a lot of people, especially our senior community, always have a lot of concerns about medications and the overuse of. But it sounds like at Hoag, there's definitely many different options, multimodal, meaning that there's many different specialists on the team that could help provide a wide gamut of solutions to address pain. So that's wonderful to hear. Well, I'd like to then ask Sarah, can you tell us a little bit more and educate us more of the role of the physician assistant when it comes to pain management?
Sure. And that's a question that I know myself and our other PAs get asked a lot. I think it's important to clarify that patients are not necessarily getting a lesser experience by seeing one of our PAs or nurse practitioners. Our main goal is to act in very close collaboration with our physicians to help treat patients. So that often looks like follow-up visits, responding to messages. We definitely participate in the diagnostic workup of patients, and sometimes as patients' pain progresses through treatment, other things pop up, and we are always careful to address that. But again, always in very close collaboration and conversation with our physicians on our team.
Dr. Fahmy, what would you say the importance of the work that Sarah Vargas and our other physician's assistants, how do they contribute to caring for our patients?
Yeah, just like Sarah said, she's a continuation and extension of the care that we are providing to the patients. We are all providers as part of this team, but as far as access is concerned, for patients, we have physician assistants to help in seeing our patients and managing their pain. Physician assistants and nurse practitioners don't work alone on an island. We collaborate. We talk about the patient, even if I'm not seeing that patient on that specific visit, but we are still talking about the care. So the important thing is that the care is the same, whether it's through me or through the physician assistant. The idea is we want to provide as much access and resources to our patients through our providers as possible.
We talk to patients all the time who are missing out on activities that they enjoy, whether that's walking their dog, playing with their children or grandchildren, perhaps playing pickleball, and it's because of pain. So it's very important to come see us if they're having pain. Please let us help. We want to get you back to the activities that you enjoy.
That's a very empowering statement. Thank you for sharing that. Well, before we close, what's one thing each of you would like to share with our viewers today?
Sure. I think I probably sound like a broken record, but the most important thing is, if you feel pain, try not to ignore it. Come and see us because we're here for you. That's my job. That's what I do, and I enjoy doing it. And I just want you to know that I'm not treating your MRIs or your X-rays. I'm treating you as a person and as a patient, and that's an important part in how I approach my care for my patients. So, at the end of the day, it's nothing to be afraid of. Hopefully, we can get you some help.
We have a very friendly team. Everyone from the physicians, myself and our other physician assistants, our medical assistants, the team who schedules appointments, everyone is very friendly and truly cares about the patients that we see and taking care of their pain and getting them back to the activities that they enjoy. So, we all love what we do. This is what we do for a living, but we truly do care about the people that we're treating.
Beautifully said. I really appreciate you both and the comments that you just shared. What I've just learned about Hoag Pain Management, so many different options to address pain. We have an amazing facility now that's going to help increase access and even the quality of care that we're able to deliver. But listening to you both, it's that compassion that you have for the patients that you're treating. So I really do appreciate you both. Thank you for your time.
Thank you.
And to our viewers, if you're living with pain, chronic pain, ongoing pain, please think about the experts that you've listened to today and come seek us. Come seek our help. We have a very compassionate team. We have many different options to address various different types of pain. And we're going to use the most advanced techniques and procedures to really care for you. But it really is about the compassionate care that we're going to provide. And we're really looking forward to taking care of our community. You could learn more by going to hoag.org or call us to schedule a consultation. I'm Jeremiah Yang. Thank you for your time. Have a good day.
You don't have to leave Orange County to find world-class healthcare. 1,800 top physicians, 400 physician offices, 15 urgent care centers, 9 health and wellness centers, 6 specialty institutes, 3 award-winning hospitals, 1 world-class healthcare system, right here in Orange County. Choose complete care. Choose Hoag.